I like to mention briefly about vitamins. When I went to medical school, I was pretty much told that unless you had some rare genetic condition or lived in the third world, there was really no reason that anyone would ever need vitamins, that our diets are very healthy and we get everything we need from our food. But in fact, what we know is there actually are quite a few people who have various vitamin deficiencies, and there's several reasons for that. One very important nutrient that I found to be very important with weight management and blood sugar regulation, which is very important with this insulin resistance, is vitamin D. Vitamin D is made in our skin from the sun. So you don't actually have to take it in from diet. But we live here in Florida, and I test my patients because I found that low levels of vitamin D actually make it hard for somebody to lose weight. And replacing them to optimal levels help. And many of my patients are deficient in vitamin D. And you may ask, how can that be? We're in the sunshine state. Well, we use sunscreen, and also our ability to make vitamin D from the sun decreases as we get older. You can only make about 25% as much as you did at age 20 if you're, say, 60. And you do have to expose your entire body, arms and legs and torso, to the sun for about 15, 20 minutes, several times per week to get the effect from sun. And we've been really told, don't sunbathe, it's terrible, photoaging and skin cancer and all of that. So I find that so many of my patients are deficient and need to take some vitamin D supplement. I also find some other common nutrients that my patients are deficient in is vitamin B12, which is a very important nutrient for energy metabolism, and there's many reasons for that. As we get older, our stomach acid decreases, so we don't absorb the B12, and a lot of medications affect the ability to absorb B12. Like a lot of people take acid-blocking medications and certain medicines for diabetes or other conditions which affect the absorption of B12, so replacing that is important. I also find that a lot of my patients are low in magnesium, and magnesium is very important in, again, this whole glucose insulin pathway. So I test all of my patients for those specific nutrients. I often find that they're low, and I replace them, because just like that cell that was low in sugar and starving, if our cells are depleted of nutrients, they're also going to resist weight loss, and we don't need more things working against us. I have certain recommendations. I actually do think that most people do need a multivitamin. Our farming practices have changed. A lot of vegetables these days don't contain as many nutrients as they did years ago because magnesium and certain minerals are not replaced to the soil. So I find most people do need a good multivitamin. And especially if you're dieting and trying to eat less calories, a good multivitamin is helpful. I find, as I mentioned, many people need magnesium. Many women need additional calcium, but there's recently been some changes in the total amount of calcium that's recommended for women. I mentioned the B12. I very commonly find it low. And I find that fish oil can really be a very helpful supplement. The EPA or DHA supplements that come from fish oil really help with lowering the triglycerides and improving insulin sensitivity, and I find it to be very, very helpful. And then, of course, vitamin D, which I find to be very common in my practice, actually helps allow people maintain a more normal weight. Now, with regards to vitamin D, it is fat soluble. You could theoretically take too much. So if somebody is really replacing vitamin D, you have to check levels and monitor and make sure the level is the right level and not too much.